Hi everyone, Dr. David Warwick at Warwick Chiropractic and Massage. I wanted to give you an update. This is week 4, almost completion of week 4, which will be about 30 days since the surgery, and being a patient myself, and just created or had a recent video with Colby from WADA Wellness and cold plunging and use of ice, and the benefits are many for you guys, and we encourage you to do this in the office, especially with treatments using ice to reduce pain and inflammation. The only time you wouldn't use it is really with certain contraindications like autoimmune conditions, scleroderma, Raynaud's, severe arthritis, rheumatoid arthritis, and it wouldn't be used. That's when the moist heat and dry sauna or the saunas can be really helpful. But use of ice, I have to say, guys, the best benefit that I had, and still today I'm using it, is ice therapy. Even with the surgery, I think that's the only thing that has been able to reduce that pain, even despite the prescribed medications they're recommending. Yes, some of that is helpful, like nighttime when things got worse, but after this surgery or knee replacement, I'm a big proponent of it. And so you heard me do, or maybe attach with this, Colby's Water Wellness or the cold plunge. Well, because of the incision, I can't technically get it wet or submerged, the incision, for up to 6 weeks, but I'm going into the cold plunge about up to the incision to help with that, and you can acclimate with that. But the benefits of cold therapy are many: reducing pain, inflammation, can increase range of motion, obviously bringing fresh blood and nutrients to the area. Do your research on cold plunging, as well as use of ice therapy. Before, after workouts can be really helpful, especially after, for recovery, recovery from an injury, and especially when you get an adjustment. We often encourage you as a patient, please use ice on the same day, because many times when you treat soft tissue, things can get worse before they get better. That's the body's natural response to reduce the amount of swelling and inflammation that goes on, to retrain certain tissues, the nervous system, the nerves in the body. So look for the content and information. I know we're going to have a bunch of videos and other recordings with Colby, obviously, in the near future. Colby's a local, Colby Caro, Kero, a local business owner, and I'm always happy to support local businesses, especially if I'm using it. And I think most of you guys know, anything that I recommend or you recommend to you, I'm personally doing, especially during the surgery. I'm personally using it as well, recommending it to my family and friends. So it's not something that, you know me well enough, I'm not pushing some kind of product or item just to sell it to you. I'm making sure there's benefit myself. So I'm personally using it. And I think that's an important thing. You can ask any provider, what would you recommend for your best friend? What would you recommend for yourself? And then you start to get very real with the answers on that. So, hey guys, thanks for listening. Dr. David Warwick of Warwick Chiropractic and Massage, Lacey, Olympia, Washington. And do know Dr. Kievit and Dr. Champagne are in the office to serve you while I'm out doing my recovery and rehabilitation. So thanks for being great patients during this time. Enjoy the start of your summer. I'll talk to you soon. Bye.